Hello, everyone. Thank you for joining in today. Let's get the specs on vision. Today we have Angel Perez, who is our resident visual assessment expert, but so much more. Angel is going to give us a little bit of information about why she got into this, how she started, and this visual psycho. Finish it up for me, Angel. Take it away.
Visual psychophysics.
Yes, visual psychophysics, which I just learned today. So, because Angel is a great teacher, in addition to an amazing presenter, and she's going to give us a little bit of, she's going to tell us what that is, and then she's going to give us a little bit more information on today. All right, Angel.
Hi, it's really good to be with you folks. I'm so happy to be with all of you and with Tasha. I feel honored to be able to do this presentation for you. My name is Angel Perez, and I have a long background, but I will make it short. I started out as an interpreter for the deaf, and we had vision issues throughout my whole life with different people in my family. Um, and I was tasked at a crossroads as to which one to pick. So I decided I would do them both. So I went to school for vision impairments and communication disorders and deafness. Once I received a scholarship after my master's degrees were finished, I really delved deeply into vision because vision is like spider veins. It just keeps going and going and growing and growing. And there's so much to learn that I don't know if you could ever encompass all the information and the knowledge there is to know about vision. So I was very intrigued, love a challenge, and decided through the scholarship that I would be switched to the School of Medicine, and I received a degree in vision research with an emphasis in visual psychophysics, which is a little bit of physics, a little bit of psychology, a lot about vision, and a little bit about neurology, which helps me kind of encompass so many different things. So visual psychophysics really focuses a lot on perception. So that's how all of those things get encompassed, is because visual perception is a wide, vast field, everything from color vision deficiency to contrast sensitivity, just all different types of things. So depth perception. So that's where we are, and that's where I am today. But my passion has become children. I work for the Florida and Virgin Islands Deafblind Collaborative, and have been doing a little research and finding that our babies are being missed, that we're missing the boat when it comes to finding or identifying disorders in our babies. And sometimes by the time they are identified, it's too late. So that's what's bringing me here today, because I really want to inform parents and others, professional providers, early interventionists, anyone who is willing to listen. I'd like to provide as much information as I possibly can.
Right. I'm going to share my screen, and I'm going to, well, open this. I want to make this larger. Well, I do want to make this larger. And this is our lovely visual that we have on our s'more flyer. But I think this has a lot to do with how we look at vision, because that's what we think vision is, just that right there. That's you, Angel.
Yes.
So this is our agenda that we're going to kind of get into today, but there was this. Here is a few definitions that when we were planning that I thought were really important, and hopefully everyone can see when you say that students are being missed and babies are being missed. I know that charge syndrome is it's huge as far as the coloblomas.
Colobomas, very good. Yes.
Colobomas. And when we think about vision, low vision, and blindness, what that means. So this is going to be on our s'more flyer. But I really wanted our family and friends and professionals out there to kind of have a good grasp of what we're talking about today in writing and vision and how important it is. Because when we don't catch it, then our kiddos start suffering in school and in their social aspects because they want to be included, but you need to be able to know what it is that you need in order for that inclusion to happen, right?
Yes, exactly.
So here's our agenda. Here are the vision specs. I like that word. so
I do too.
so Angel, talk to us today about the importance of visual health, what it is, and how it might manifest in an educational setting.
Okay. Well, vision health consists of vision screenings from the start of life. There's controversy over that particular statement due to the fact that there's a lot of people that don't understand how to start at the beginning of life assessing vision. We hear a lot of things. I hear a lot of people say, well, when it's birth to 3, I rely on a wellness check. Well, our pediatricians are fantastic people. Don't get me wrong. I love pediatricians. However, those pediatricians are focused on the whole body of a child. They're not focused specifically on eyes. They are worried about the whole health of the child. So they will do a minimal inspection of the eye up until they're about 3 years old. And then they will get a little more in depth usually. But there's so many things that are missed between birth to 3 that by the time they're 3 years old, now we're verging on, is it going to be too late? How easy is this going to be to correct? What can we do? So that is basically what vision health consists of. It consists of screening children from the start of life. You have so many, and people will say, well, that isn't that the job of the optometrist? Well, it is when the child gets to a certain age, but until they get to a certain age, even they don't do this. So you have to, we want to teach all of our people who are involved in children's lives on a daily basis what to look for, how to screen a child, and how this affects their education. So approximately 80% of all learning comes from the visual pathways.
Wow.
Yes,
That
80%.
is huge.
So
That's huge.
if you think about that, Tasha, 80%, that's huge. That's most of everything that you learn is going to come through the visual pathways. Now, hearing does play into that, and the loss of hearing does play into that. So if you have a vision and hearing loss, now we're up to about 90 to 95%. But think about all of the things in your environment and what you take in just by being able to see. People take that for granted, but think about all the things that you see in your life every day and how much that contributes to what you know. We just don't think about it because it just comes natural to us. So, but for those who have vision impairments, it's not that easy and it's not that easily explained. So any interference that you have in the visual pathways can inhibit a child from performing to their maximum potential. So you're not just looking at near distance and distant objects. Okay, it's not just about a visual acuity test, and that's what everybody seems to want to focus on. Okay, can my child see 20/20? Can my child see 20/40? What do I need to do? It's not just that we need to be focusing on. There are actually 17 visual skills that's going to be necessary for a child to be successful and for clear vision. In almost every situation, you have 17 visual skills. And visual acuity is just one of the minute things. So we're looking at things like eye movement control, binocular coordination, convergence, visual memory, visual thinking, peripheral vision, depth perception, color perception, fine and gross motor skills, and so many more things. So we're looking at all of these different aspects as a whole to understand where our child is and whether or not they are seeing well and can succeed to their full potential. And so that's some of the things that I want to, that I wanted to bring to light to this group. How that affects your education? Well, let's look at it from this perspective. So strong visual skills are going to be crucial. It's imperative to all aspects of learning. Again, think about how much learning, incidental learning, you have just by looking around in your environment. You know what a book is by looking at it, right? You know what a picture is by looking at it. But what if you can't see it? Then do you know? So some of the things that's going to affect in a child's daily life is everything from reading, spelling, handwriting, comprehension. Oh, and you're going to love this one, Tasha, because you and I have talked about this a few moments ago, but concentration and attention, right? So vision really affects concentration and attention. So when you're looking at the whole aspect, does the child have ADHD, or could it be a vision issue? Because if you have low vision or vision problems, what happens is you can't concentrate and you can't pay attention. And there's also visual fatigue. So you're going to kind of shut down. So it affects just about every aspect of education that you can think of.
Wow. Yeah, that executive functioning piece is huge. I really didn't take all of that into consideration when I know when I think of vision, I think of, you know, just one or two different things, but 17, that is a huge piece. So I want to skip around a little bit on our agenda and go to assessments and think about what would assessments look like like, what am I looking for? What is a professional looking for in the school system who's checking for vision needs?
Okay, so what does an assessment look like? Um, if you're talking about like the day and the life of vision screening, I guess what that's going to look like. Um, well, so some key things that you would want to know about vision and vision screening is that you want to make sure, if it depends on the age. Okay, so screening, it comes by age. You cannot do the same thing for birth to 3 that you do for 4 to 5 and 6 years and up. So there's different variations of what vision screening is going to look like. You want to make sure that you have a good relationship and a good rapport with the child that you're working with, regardless of the age, because we want them to trust us. We don't want them to fear us, because they won't do well. They won't participate, and they won't comply very well if we don't have that trust built in them. You want to make sure that you get some type of a parent interview medical history, and understand, are there people in the family that have vision issues, and what they might be and how that might affect the child or their vision. And if we start as with age, let's look at birth to 3. So one of the things you want to do is you want to use the good old-fashioned gold standard of vision screening that's provided. And those are going to be various tools like a pen light, contrast sensitivity tools, different aspects like that to get it. You aren't able to use a vision screener on a child until they're about 3 years old. There is one vision screener out there that vision that is called the blink, and it will screen back to the back of the eye to the retina, and you can start that at 2 years old, and that's to detect amblyopia and strabismus. But until then, APOS, which is the American Academy of Pediatric Ophthalmology, and the American Academy of Pediatrics both recommend that you do not try to do vision screenings with instruments until they're pretty close to 2 years old.
Now, Angel, you said something myopia. And
Myopia.
if you, yes, and if you could break that down for our folks who are watching us.
Okay, so let's look at the different aspects of what can happen to a child in various ages. Tasha's talking about myopia. Okay, so let's look at some birth to 3 issues. Okay, so let's think about you can have myopia. Myopia is where you don't see distance as well. You can see close up, but you can't see far away. Then you have hyperopia. That's where you can see far away, but you can't see close up. So reading is going to be an issue. But then you have astigmatism, which affects both distance and near acuity. You have amblyopia, which has 3 different aspects of amblyopia. There's deprivation amblyopia, there's refractive amblyopia, and there is strabismic amblyopia. So you've got 3 types of amblyopia, and they affect your vision in different ways. So let's look at strabismic amblyopia. That's an eye turn, and that most of the time is visual to someone. When you see a child's eye wander to the nose or wander out, but it can also be intermittent. So there's a test for that, because you could be looking at a child and their eye is not wandering off, and you've got to see whether it will or it won't, and that's intermittent. That is intermittent strabismus. Then there's other aspects. You can be born with cataracts. Most people think that's an old folks thing, right? But it's not. Babies can be born with cataracts. Babies can have glaucoma. That's another old folks thing. Oh, these old folks are having, these drops, and we have to keep a check on their pressure to make sure that they don't lose any more of their vision. A baby can be born with that. And so there are a whole host of things that a child can encounter. One of the most heartbreaking things, and it is rare, but it does happen. And I wonder if we're missing it. Is retinitis pigmentosa, not retinitis pigmentosa, but retinoblastoma. I always get the 2 mixed up. You'll have to forgive me. But retinoblastoma is eye cancer, and it's more prevalent in birth to 3 than any other age. Now, I'm not saying that it can't happen in other age groups, because I've witnessed it, but birth to 3, it's more prevalent. What happens with that is, I have a little story. I had a student in New Jersey, a child in New Jersey that I was working with. And when he got around kindergarten age, it was discovered that he had retinoblastoma. Now, I don't know how long, because I didn't have the opportunity to talk to the medical professionals that were, testing him for this. And the parents really didn't seem to know a whole lot about it, but they caught it. And what happened is, at the stage that the retinoblastoma was in, the child had to have an eye enucleation. So what that means is that they remove the entire eyeball. And the child, of course, is profoundly blind in that eye, and they have to have chemotherapy, which is detrimental to everybody's system. If you can avoid chemotherapy, because that's a poison to kill another poison, right? A cancer. So the child had to have that done, and usually it's unilateral. However, this particular child came back around 18 months later with retinoblastoma in the other eye. And at that particular time, and because of his prior health history, they had to take the eye, and he had to have chemotherapy treatment. So now this child can't see anything. So this is kind of touching to my heart, because I watched a child suffer through it, and he suffered through it twice.
What kind of screening would have helped to, like, would I have been able to see it? Would someone in the school been able
Yes,
to
ma'am.
see it? How would we see it?
Okay. There's a thing called a red reflex test, right? And so you can, as a parent, if you understand how to look at some of these things, or an early intervention teacher or a regular school teacher, you can see it. You can take a light, a pen light, or a flashlight, and just briefly flash it over the eyes, and you'll see a reflection. That's why they call it red reflex. You'll have this red reflex. It'll be a reflection that will reflect back at you. It won't be your normal pupil. It'll have it's just like a reflection that comes back at you. And that is the detection of retinoblastoma. And so that is something that people can see. You can also, and this is an example that I gave our friend Pam earlier. You remember when you used to take pictures of people and their eye and their pupils had that red all in them, and then technology came along and cleared that up. So now we can take
Remove the
pictures,
red eye. Yes.
and we don't have that anymore. But if a child has retinoblastoma, you're going to see that. You can take a picture of a child and see that.
Wow. That is amazing. And it's now and that is any age range, right?
That's any age range.
Okay, because I know we talked a little bit in the beginning about, you know, what we do from 0 to 3, what we do from like elementary, what we do from middle, almost like, you have a shirt and that might be too tight, then you got to go to the next thing for the assessments. But this is something that is universal across the board.
It is. And there's a training program out there that will teach anyone interested in learning more about vision. So here's my passion. This is what I'm trying to do. While I am focused on vision across the board, any age, okay, so kindergarten, 7th grade, I don't care. I'm focused across the board on it. Right now, if you look at state regulations, they're all over the board. Did you realize that there are some states that are not even required to do vision screenings for your children? There are states that aren't required. Now, I'm not saying they're not doing them, but that's a choice. It's not a requirement, and it should be a requirement. There are states that don't start until your child is in kindergarten or 1st grade. And if you look at the regulations, the guidelines, the state guidelines, it may say we're going to do one in kindergarten, we're going to do one in 3rd or 6th grade, and that may be it, right? These eye disorders there's various different types of eye disorders that can develop throughout life. So if you don't have it in kindergarten, then you're out of luck if you develop one in the 1st or 2nd grade, right? Because somebody may not catch it till the 6th grade or the 3rd grade or whatever their state guidelines mandate. So we need a more cohesive set of guidelines across all states. And right now, your people that work with birth to 3, most of those people are not trained, or they don't understand, or they don't know. And it's not because they don't love the child or they don't want to know. There's just nothing out there. It's not them. There's nothing out there, which made me very passionate about developing a program. So we have a training program for anyone who works with a child and is interested in it from birth to 3, so we can catch things very early. I work with Dr. David Hunter from Boston's Children's Hospital. He's a contributor to some of the information that's in this training. And there's a kit that follows along with it. But going back to what you're saying, there's things that are going to be missed if we're not dedicated to finding them. And the effects can be devastating on a child throughout the rest
So,
of their life.
so in that same vein, I'm hearing that the challenges, so like when we don't use the right test, or we're missed, and we hear about how some of the effects that it can have on the child, there is a larger piece here. And could you explain it to us, like what those challenges might be? More of those challenges?
You mean the challenges for a child with a vision impairment, or
To use the different, what happens if you use the wrong tool
oh,
in
okay,
this?
I'm
Yeah.
sorry. Okay, so what happens? Okay, so what happens if you use the wrong tool? If you're using the wrong tool and the wrong guidelines or the wrong methods to screen a child, you're going to get false positives. I'm going to give you an example. I'm going to take a 6-month-old and I'm going to use an instrument-based screener on this child. This child's eyes is still developing, so I'm automatically going to get a referral. It's going to be a false positive. So while we don't want to miss anything, we also don't want a ton of over referrals, because then that's the scenario of where, the wolf cries one too many times and then people stop paying attention, right? So we don't want that to happen. We want to make sure that when we're referring them to someone, that there's a legitimate reason. But if you're not using the right protocol and the right tools, you're going to either miss it or you're going to over refer that child. Either way, it's not a good situation either way. Like I said, if you're using an instrument-based screener on a child who's 6 months old, you're going to get a referral most likely. It's possible, it is possible that you might not for some reason, because I'm finding there are things that you can do to actually alter those tests. There are certain ways you can hold those instruments that will alter the results. So you have to be very careful. And when you're using instrument-based screeners, you have to follow the guidelines and be well trained so that you are getting the correct results. But from birth to 3, I don't recommend any instrument-based screening. I recommend specific tools that have been in play for many, many years and was developed by pediatric ophthalmologists for that particular use.
Now, is that something that you cover in your guide that you created?
Yes, it
Oh,
is.
right.
I show you the purpose of the screenings, why they're important. We talk about the different visual disorders that can occur. We talk about how to screen a child externally. What are you going to look for? You're going to be looking for crusty eyes. Is that a blocked tear duct? Maybe. Or it could be some type of infection. Are we looking, how to recognize pink eye, which most people probably know how to do that. But are you aware that not all pink eye is contagious? However, you don't want to take the chance. Okay. So you've got viral pink eye, bacterial pink eye, and then you have allergic pink eye. So if the child has an allergy and gets pink eye, you're safe, you won't get it. But I would personally let a medical professional diagnose that, rather than take the chance that it might be the viral and then you're going to get it. And everything you touch and everybody that touches it's going to get it. So, because there's no way that your average person can distinguish between those. So a medical professional would need to do that. But we
So
talk
that's
about
why they
all of
say if
this.
you get pink eye, go to the doctors. Don't try to do it
Don't.
yourself at home, because I who knew that there were different types. There's just
Different
one
types.
type, and that one type has to be treated.
Yes, there's different types, but in my world, pink eye, hands off, because you don't want it yourself and you're taking that risk. in trying to figure out which kind it is, unless you're a medical professional and know how to do that. But we talk about visual disorders in this. We also talk about something that's really important, which is visual milestones and developmental milestones. This is where the function comes in. What happens if a child at 12 months old, right? They're a year old. Most parents are expecting them to start learning to take their first steps. What if the child pulls up on the count and hesitates and won't take the first step? And you're thinking, okay, so he's developing a little slower. That's okay. It's not a problem. But now, 2 months later, the child's still pulling up, but has this distinct look on his face and still won't let go. Is that a vision problem? Is he not seeing, clearly? Is he having a depth perception issue? Does he feel like he's going to be falling into a dark hole? What is that that's impeding him from letting go and trying to make those first steps? Is it a developmental issue? So we have to have an understanding of those different types of milestones, from vision milestones to developmental milestones, and try to work through that. There's also something that is just now being recognized by the National Institutes of Health and the National Eye Institute. And I say that because I personally have not seen anything up until last year, and I did attend an 8-hour session on something called cortical visual impairment. And they did this session on the awareness. Now, if you're not aware of cortical visual impairments, and most people aren't, it is the leading cause of vision loss among children. Now, that's not ocular vision loss, because that would be amblyopia, but the leading cause of vision loss among children in America is going to be CVI. So there's a little bit of difference. Why? You have a visual system, and it goes from the very front of your eye to the back of your head back here. This back here is called the occipital lobe. Okay, so you take a child to an optometrist, they're looking for what's going on with the visual mechanics. Can the child read an eye chart? Can the child distinguish in contrast sensitivity? Those things. So with this, it affects the dorsal and the ventral streams back here, the pathways. So it goes past what's called an optic chiasm. Don't worry too much about the terminology, but just know that it passes that ocular mechanics and goes back here to the brain. And it's a disorder of processing. So the child doesn't understand anything that it's seeing. It may physically see something, but it may look like a blob of colors running down the wall, or it could look like Where's Waldo? If you've ever done Where's Waldo? Waldo's a very hard little guy to find. So for a child with the CVI, they would never be able to find Waldo. They could never find him. As a matter of fact, that would be so overstimulating that for some of our children, especially those with disabilities, they're going to melt down or shut down. Either one. They're either going to get very upset, or they're just going to shut everything off because they can't process that visually. It's too much. It's very overstimulating because they don't understand what they're seeing. And there's 10 characteristics that need to be followed up on that. So so now you understand when I say that vision is like spider veins. It just keeps going. All these different vessels just keep popping up and going in different directions. And now we've got to go follow this direction and that direction and this direction and that direction. And it's just, while I don't want it to be overwhelming, what I do want people to understand is that if they detect that something's going wrong, let's get that thing looked at. Let's get someone to take a look at that. And if you're a professional in the field and you're with a child every day, look, there's signs to look for. Look for those signs. There's assessments that you can do, screening assessments. They're not comprehensive vision exams like an optometrist and ophthalmologist would give, but there are things that you can do to detect that and get that child to the proper care that it needs. And it's imperative. It's imperative.
Well, and that's how we can collaborate, I think, across. I think that's our last one on our specs is like how we are working with one another, whether you're the parent or the school, how we can work together so that we're addressing the vision needs of that child quickly. I think that, I think from everything that we have spoken about today, what's resonating with me is that time is the most important factor in all of this, because we can address this a student's need or a child's needs pretty early if we have the right tools to do so.
Yes, ma'am, that's exactly right. You can do that, and we can save so many children from vision loss, and even worse, uh, in the explanation of retinoblastoma. We can save the child grief and heartache and pain. We can make a child successful. We can make them flourish, but we have to be able, one, to be able to detect it, two, to use the right tools, three, to understand what a referral process looks like, and four, you have got to be able to work together. Now, parents, teachers, and medical professionals, you're all a team. Every one of you brings something special and unique and specific to the table. You're the parent. The parent knows the child. No one in this world knows that child better than its parents, especially its mother, the one that gave birth to that baby. She's going to know that child. She's going to know the ins and outs of that child. She knows every physical speck on the child's body. She knows, she does. And she knows
Every mole, every pimple, everything.
Everything. Now, will she be able to pick up on vision loss or anything? Potentially not, until she knows what to look for. We can teach her what to look for, so that she can pick up on that. But she's going to know every little speck on that child's body. She also knows how that child works. She knows that child's personality. She's going to know what makes that baby tick, right? Whereas me as a professional in the classroom, let's just say I'm the professional that's in the classroom, I'm not going to know those things. I'm not. I can spend the year with the child and I can learn some things and I can get some idea, but I'm not going to know all of those things like a mother's going to know them. Then you have the medical professional. Now, those folks know medicine. They can pick that stuff up and they can treat. But if follow through doesn't happen, then the treatment stops right where it is. It's no good. So we have to work together as a team. We have to listen to each other, and we have to understand what is part of the specific piece that you play, and play it well. I learned something from my nephew who's in college right now for business. And he is writing these papers that I am luckily getting to proofread for him for grammatical errors. But anyway, right now he's learning something about the dysfunction of teams. This is what I'm talking about. One person can be satisfied with whatever's going on among the team, but if everybody doesn't have buy-in, then the team fails. So people remember this, folks, remember that. If you all don't have buy-in, the child is going to fail. You can't let egos or arrogance or anything get in the way. You have to reach out and get hand in hand with each other as a team. PTs, OTs, speech, vision, hearing, they all have a specialty, but they don't know the other person's specialty. But if you all combined everything together, wow, what a powerful packet you can make for that child's success. That's to include all medical information that you get and medical advice that you get from the physician, and everything you can get. Let me be specific, and let me emphasize that clearly. Everything that you can get from a parent, every ounce of information that you can get about that child from a parent. Don't leave anybody out. It's going to be detrimental to the child. Please think about the child and the child's future and what that is going to mean for the child. IEP meetings can be a good thing, and sometimes they can be contention in IEP meetings. We need to come together in IEP meetings and set goals for those babies. Look at the different goals, and it's not just your educational goal, but the child should have some vision goals. If there's issues with that child's vision, then there should be vision goals laid out there, and their educational goals should focus around what they can do with their vision or their hearing or their motor skills, whatever the issue is. That's what you want to look at and base your goals on, not just strict academic standard goals. You've got to bring everything in. It has to be all encompassing or it won't work. There is an article out of a book called Collaboration. Let's see, that's the article name, sorry. The book is Family-Centered Early Intervention, Supporting Infants and Toddlers in Natural Environments. Okay, let's look at that for instance. That says infants and toddlers, but the chapter 2 says collaboration and teamwork with families and professionals. That spans across the whole spectrum of a child's education. And there's a case study in there on a child who's 8 years old. I would recommend that people read that. And I have a link, Tasha, that I can get you if you want to post it on, your social media sites and things like that. Because
I would love
recommend
to.
it. Yeah, I would recommend that you read that and understand what the implications are and what that means. And I can't express myself enough and tell you the importance of that. I have stories in my own life that have impacted vision in my family's life that really tugs at my heart. My mother had a tumor behind her right eye, and it was interwoven so tightly that she had to have the optic nerve cut. So she lost vision in her eye, but the tumor itself was, while it was not malignant, it was still going to be life-threatening because it was growing rapidly toward her brain. So it had to go. My son had bad experiences with vision. He was having migraines in the early parts of his years. I'm a young mother. I'm not educated in vision at that time, knew nothing. I was just a young mother wanting the best for my child. And the optometrist that we took him to was not a pediatric optometrist, but we lived in this tiny little town where there was really only about 2 optometrists there. And so he was missed, and the optometrist waited too late. And now my child, if he is not aided, meaning if he don't have contact lenses in, or if he doesn't have his glasses on, if you're looking at these charts, these eye charts with the big E, those are called Snellen charts. My son can't see that E. That's huge. That means that he's more than legally blind if he doesn't have his glasses on, because somebody decided to wait too late to do anything. My grandson, fast forward to a little bit further, my grandson was born. When he was born, I was in the heart of my program, my PhD program, and I was holding him. He was just a couple of weeks old, and I noticed immediately that the child had something called anisocoria, which is uneven pupils. One pupil was bigger than the other. Now, that can be nothing. That can be just some little something, maybe a pinched nerve or something that's caused that to happen. It could clear itself up in the future. He may always have it, but it won't affect anything. It won't affect his vision. But it's also a precursor to cancer as well, to some type of tumor. Whether it's malignant or not, it is a precursor. So I alerted his parents to the fact that he had it, not what it could do, because I didn't want to scare them to death. But the first thing I did was, because I was doing some clinical rotations with a pediatric optometrist. Her name is Dr. Frazier at the University of Alabama in Birmingham. She is what's called an infancy provider. And folks, this is extremely important. An infancy provider is a specially trained pediatric optometrist who works with babies. Not every pediatric optometrist is trained to do that. So you want to Google infancy. It's INFANTSEE. And you want to look for that because the child can get its first eye exam at 6 months. So I took my grandson and she did a thorough eye exam to make sure that the kind of anisocoria he had wasn't detrimental to his health or his vision. And I'm so grateful for her for doing that. That eye exam from an infancy provider is free, regardless of insurance, regardless of your financial situation, whether you've got millions of dollars or $0. It doesn't matter. Infancy provision is free up to the first year of life and they usually start at 6 months. So keep that
Wow.
in mind.
And see, and that's huge. I know in the state of Florida, we have a vision screening before babies leave the hospital, but you're saying that we can ask for an infancy provider on top of that. And I am so excited to hear that. I think for our families and for our youth and for our professionals that are out there listening, that when you have a circle of information, that everybody is bringing something of value to the table. And it's so important that we all work together in order to get the needs of that child, that baby, or to get it met. But in order to do that, we have to communicate effectively with one another. So,
Absolutely. And
Angel,
one other thing I wanted to mention, and this is also very important before we wrap this up. If you don't feel comfortable with the first diagnosis, don't feel uncomfortable about asking for a second opinion, okay? Because I've had issues with optometry, ophthalmology, whoever, pediatricians even, who've given a diagnosis and it turned out to be incorrect. Don't feel bad about just getting that second opinion. Those are very important.
and I appreciate that. I think coming from a space of you have all these things that you have to juggle, and you're like, oh, I have to do something else. No, if you don't do it now, you'll have to do it later. And later really may not be in the best interest of you and your child. So, Angel,
That is correct.
thank you. Thank you, thank you, thank you. And thank you for providing all of the amazing facts. And I I I feel honored because I got a chance to learn. I love doing presentations and workshops like this because I get a chance to learn, and that means I'm growing too. So thank you. And I will make sure that when our family see this, your contact information will be there, and you'll have to give me a screenshot of where the assessment is on the FAVI DBC website. Or if you want, you can share it now where families can go to find it, so that there will be no mistaking. This is how we can get there and make sure that our kiddos have what they need.
Absolutely. So would you like for me to put that in the chat?
Yeah, well, yes. You
Or
send
would
it
you
over to
like
me.
me
I'll
to
put it
do
in the
that?
chat. Send it over to me and I'll put it in the chat. I really
Okay, I can do that.
yeah, I want our families to know where they can access it. And like ex we talked a little bit before we got on. This wasn't the pathway that we were taking in life, but it chose us. And since it chose us, we're going to do an amazing job getting that information out and making sure not another child is missed.
Absolutely. And thank you, Tasha, for having me here. It was such a pleasure. It is a passion of mine, and I love my parents and want them to understand and be informed, as well as those professional providers who work with your babies and your children. It's so very important, and I appreciate and feel so honored to be here today. So thank you.
Right. Thank you, Angel. And thank you for everyone who is tuning in today. If you have more questions, Angel's contact is going to be in the chat. So thank you again. Bye.